嗨，今天呢，我们来到了泰国的法政大学。这所学校也是泰国一所知名的高校。那今天我们来到了法政大学的国际医学院啊，很多同学可能对我们的医学院呢也很好奇，我们就请到了我们的老师，那让他来给我们介绍一下这里的国际项目吧。So, สวัสดีค่ะอาจารย์ I'm very happy that you can come to our channel and to introduce some of the international program to our Chinese students. So, firstly, please introduce yourself.
Sure. My name is Dr. Dave Setabut. I am a head and neck surgeon, but also I'm the Vice Dean of Student Affairs and International Affairs here at Chulalongkorn International College of Medicine at Thammasat University.
Okay. Actually, this university is quite famous for the Chinese students, especially for the students who are interested in the medicine. They have the huge interest in this. So may I ask, in our college, whether we have the international program?
Yeah, so we have a varying number of international programs. From the bachelor's level, we have cardiovascular technology. So we have a doctor of optometry. And then on the master's level, we have dermatology. We also have bioclinical sciences and integrative medicine.
For this international program, welcome all the international students to apply.
Correct.
Okay. Yes. Wow, that sounds good. We have a lot of choice. According to your background, you can choose which direction.
Yes.
So for this kind of international program, if the students join here, what kind of courses they may learn?
For example, let me talk about a little bit about cardiovascular technology. So cardiovascular technology students, once they graduate, they will go on and work in the healthcare field. So they'd work in the hospital, in private clinics. What they do is they function to monitor a lot of the machinery that works with the heart. So some of those things include ultrasound, ECMO, which is extracorporeal membrane oxygenation, which is a device that allows to pump blood through the heart and through the lungs artificially while somebody might be undergoing surgery. So they learn all the ins and outs of cardiovascular medicine and really how to keep those patients alive during that time that they have to rely on a machine.
Okay, right. It's quite an interesting major, and also it's meaningful for us to save the people's life here.
Yes.
Okay, so except the coursework, do we have any practical chance for students?
Yeah, so again, I'm speaking a little bit on that cardiovascular technology, and some of the coursework really includes, it overlines with medicine. So they have to understand how to evaluate patients, the clinical scenarios that they might encounter in the hospital. So they do learn a lot of those basics. And then in the latter years, in their third and fourth year, they will do kind of like internship in the hospital setting, so they know once they graduate what that day-to-day life will be like. So there is significant work experience, and that is in their senior level years of college.
Okay, so for this kind of practice for both bachelor degree student and also the master?
Yes, so both have clinical experiences, and they also have in the classroom experience in both the bachelor's and the master's level. So first and second year of both master's level programs and bachelor's level programs will focus on basic sciences and introduction to what that individual needs before they go on to the clinical level. And then the third and fourth year in the bachelor's setting, they will be in the hospital, in the clinic, to learn how what they learned in the first 2 years will actually apply into real life. And that goes with the master's programs as well. So they'll learn a lot of basic disease processes, etc., and then they'll see it in actual practice in the hospital and clinic setting.
Okay, so I think that is a quite good chance for students to learn some of the science in the beginning, and then the rest, maybe 1 or 2 years, they have a chance to apply their knowledge to the real practice.
Correct.
Okay, all right. Our program, they are all the international program. So whether we have some of the international students in our college already?